Hi, my name is Jesse, and I'm here to talk about dynamic airway positioning with your patient. The first thing we're going to discuss is flextension. Flextension comes from the name of flexing the lower cervical spine and extending the upper cervical spine. Our objective landmarks for flextension is simply placing the patient's ear hole in line with their sternal notch. You can do this yourself by simply lifting the patient's head, having a partner lift the patient's head, or placing towels underneath the patient's head to achieve a perfect flextension position. Clearly I can see with two towels, it perfectly aligns the patient's ear hole with the sternal notch. The advantage of flextension is it significantly increases our first pass success as well as has benefits for ventilating your patient. Next, we're going to discuss the occiput off position. The steps involve placing the patient in the right position with the occiput off of the cot. Next, you want to lift the cot up to 25 degrees. Then in this position, as a provider, you can intubate the patient while at the same time lifting their head up into a flextension position, thus increasing your first pass success. All right, now that we have the patient in the proper position with flextension, lifting the patient's head, we can now add a second provider's assistance with a jaw thrust. Your partner comes in from the front and simply provides a BLS jaw thrust maneuver, thus exposing the epiglottis to a perfect view for intubation. The last piece in our dynamic airway positioning is ELM, external laryngeal manipulation. I have the patient in a flextension position. As you can see, the ear hole is aligned with the sternal notch. Within this position, I can then now attempt intubation. With the difficulty in seeing cord presentation, I can then have my partner come in from the front and provide some ELM, external laryngeal manipulation pressure, and then I can dictate that partner's pressure, helping align the oral, pharyngeal, and laryngeal axes to help intubate the patient.